I'm going to do a quick lecture on obesity. All sorts of things about obesity, because we get a lot of these questions. And a patient the other day was telling me, well, you know, is obesity really a disease? What is this issue of obesity? Everybody says I'm fat. What is this obesity? So let's start with, everybody's like, oh my God, the obesity epidemic is so hard to decide. Is it a virus? Is it a this? Is it a that? It is not. It is really, really quite simple. We, either through evolution or through the creator, and I don't think they're incompatible, but that's a whole story for another day. Our system has evolved or created to be fast, famine, plenty, no food. So the way we're designed, when there's food availability, usually at the time of plenty, which, you know, depending on the latitude, it's either the warm months or the months where there are more fruits, more animals to hunt, etc., is feast. We get to feast. We get to eat a lot. And so we need to store that excess calories for famine, for later, either winter or the dry season, depending on the geography, where there's going to be much less food, so we don't starve to death. So we develop a system where we store energy in fat cells, fat tissue. And so that energy is stored there. For the time that famine comes, then we burn that energy back down, waiting for the feast time again. And so that's the cycle. We build up fat, we burn fat, we build up fat, we burn fat, for millennia upon millennia. The problem is, when we developed two very important things in our civilization. One was controlled agriculture, where we could grow plenty of food or animals, and two is the very technological part of our civilization, where physical work has become minimal. It doesn't matter what the field you're in, physical work has become minimal. You know, when we were hunter-gatherers, we didn't need a gym. The gym was every day. You had to go out there, walk a lot, run after the animals, butcher them, cut them, pull them back, cook them, and then you got to eat. You burnt a lot of energy getting the food, so you didn't store a bunch. Now, we don't burn energy, and we keep storing. And then what we did on our agricultural side is we made foods much higher in content in calories by increasing the refinement of sugar, the refinement of things like corn, where we make corn syrup, which is incredibly high in calorie. So we improve the caloric intake of food. As a civilization, you think, oh, that's a great thing. Now there's food availability, nobody's starving anymore. Unfortunately, the very developed countries have tilted way the other way, where we store, and we never burn, because there is no longer exercise, there's no longer famine. So now in today's society, to really burn your normal calories, you need to go to the gym, because your daily activity, your daily work doesn't burn enough calories for you to be trim and fit with what we consume. There's the obesity epidemic. It's really that simple. Our metabolism is meant to store energy and burn it. Now we just store. There is almost no burn unless you go to a gym, unless you purposely try to do the burn. So we have the obesity epidemic. A long time ago, people thought, oh, well, it's just fat. You store energy. We've known medically storage of energy occurs in fat cells. What now has become very clear is fat is just not fat. It is an active metabolic tissue. And what it does is all bad. It's all bad. It makes inflammatory proteins, cytokines, all sorts of things that are very bad for us. So the obesity problem is an inflammatory problem. It's a pro-inflammatory problem that hurts your immune system. So being morbidly obese causes constant inflammation in your body and depresses your immune system and creates a lot of, cytokines and things that really cause irritation. There was a recent article that was covered by some of the big news organizations. The cancer rate has skyrocketed in the morbidly obese population. I'm talking many folds over what it's been in the last half a decade. Why is that? The pro-inflammatory morbid obesity condition, disease, whatever you want to call it, decreases our immune system, which seems to decrease our ability to survey for cancer cells and kills them. So the obesity-associated cancers, and there's a bunch, but I'm going to name just a few: breast cancer in women, uterine cancer, colon cancer, esophagus, stomach, pancreatic, associated with morbid obesity. And so in the morbid obese folks, the cancer rate is way up. Why? Because obesity is a condition, a disease that's pro-inflammatory, that leads to heart disease, diabetes, hyperlipidemia, cancer, all sorts of bad metabolic things. So it's not just, I don't look great in a bikini, it really is killing me to be morbidly obese. And so it's really interesting because almost never in medicine have we had a situation where we have a bad disease, we have a cure, and yet the cure gets rarely applied. For the vast majority of morbidly obese patients, weight loss surgery, bariatric surgery cures the condition, puts it into remission, they get to a normal weight, a healthier weight, etc. In the morbidly obese population in the US, we're using this proven technique that eliminates it in less than 1% of patients. And it's through a lack of knowledge, a reluctance of the system, the expense of the system, but really we're way underutilizing weight loss surgery for the disease of obesity that has skyrocketed. And it is wonderful that we're finding other things like the semaglutide, tirzepatide that is impacting the obesity epidemic. But in the country, we're simply not using weight loss surgery enough to combat this huge problem. It has to be done through many approaches, many approaches. And I think the new HHS secretary has it right. Get rid of the sugary drinks in the diets, get rid of the corn syrup, get rid of a lot of the additives, have a much healthier diet, change the food pyramid where sugars and carbohydrates are less of a component and protein and fat is a greater component. Medications, weight loss surgery, all those things have to be applied towards the obesity epidemic to get it back under control, drop the complication rate, drop the cancer rates, etc. If you're sitting at home and your BMI is 35, 40, 45, you're sick. You know, it's not just, oh, people don't like how I look, I don't like, no, you're sick, you're gonna die younger, you're gonna live less, you're gonna have less quality of life. Obesity surgery, for the vast majority of patients that do it, is curative or puts the obesity problem into remission. So there's my lecture, cause of obesity, why obesity is so bad, and pro-inflammatory syndrome, and really, you need to take care of it because you're sick. It's not just society, is you're ill. You're metabolically ill if you're morbidly obese.
So that break down, I know we've talked about it before, but let's talk about the BMI real quick. Just once again to remind you how we calculate obesity and the categories of obesity. The
first thing every expert will tell you is BMI is not that good. There are better ways. There are, but they're very complicated. Circumference of the abdomen, because it shows visceral fat. There's really fancy ways to measure through impedance your percent body fat. Much more accurate. Very difficult to do. Whereas BMI is really easy to do and it's a really pretty good indicator. There are fallouts of it. Adolescents, young people, really muscular people tend to not have as accurate a reflection of severe obesity by BMI. But for the vast majority of the population, if you do a BMI, especially when it's in way out of range, 35, 40, 45, 50, it clearly indicates morbid obesity. And the BMI is a reflection of your height to your weight. There's an ideal number, whereas depending on your height is how much you weigh, if you're slim or not obese, 25 to 30, and then there's the abnormal ones, 30, 35, 40, 45, 50. The higher the BMI, the more risk of health disease and early death that there is. So a BMI of 35 is worse than 30, BMI of 40 is worse than 35, 45 is worse than 40. So incrementally, the higher your BMI, the more at risk you are for all the inflammatory issues, all the diseases, and early death. BMI is super difficult to calculate. It uses meters and kilograms in a special formula. Just go to any website. They all have the calculator.
BMI calculator. Google BMI calculator.
You put your height, your weight. You can do it in feet. It converts it into meters, and then it shows you your BMI. And if your BMI is over 30, you need to do something about it. Unless you're a football player and all muscle, then yes, you'll have a high BMI even though you're in amazing shape.
Yeah, and usually I know there was like a big news article last season of Dancing with the Stars. One of the competitors, she was a professional rugby player. And, she came out and said, she had a 32 BMI, and she's like, they want to tell me I'm obese, she's all muscle.
She's muscle.
The woman is like all muscle.
Her metabolic rate is high. Yeah. Her muscle volume is high. She's not going to have pro-inflammatory. Remember, the weight that causes disease is the fat weight. So if it's your muscle weight, that's not causing disease. Mm-hmm. So a super muscular person is going to look like they have a high BMI, but it's not related to obesity. When the weight is fat, kills you. When the weight is muscle, good for you.
And where you carry your fat, does that affect?
Absolutely. What's called visceral fat, intra-abdominal fat, is the worst fat, which is why a man with a BMI equal to a woman tends to be sicker. Why? Because a man's most fat storage is visceral, where women have other parts where they store their fat, hips, area. So though that fat tends to not be as metabolically dangerous as the fat around your organs. It's called visceral fat, intra-abdominal fat. So the big man with the big belly gonna be much sicker than the obese woman that has the fat distributed elsewhere.
A little more
because
evenly.
visceral fat is the most dangerous.
Okay.
All is bad, but
Right.
the more visceral fat, the more dangerous fat.
Makes sense.
Which I tell a lot of my patients when they come in and they have men with a lot of visceral fat, they want to sleeve. I go, I'll do it, but it's not the best because that visceral fat is really risky. You need a really effective operation. The gastric is much more effective than the sleeve. So for people with a lot of intra-abdominal fat, I typically recommend the gastric because they're a higher metabolic risk from their visceral fat.
Makes sense.
There's a good fat that's called brown fat that they're trying to figure out how to increase brown fat. It's actually metabolically good fat, but we have very little brown fat in the human body. Other animals have more of it.
Oh, I never heard of that one.
Yeah,
That was a new one on me.
just so people don't go, oh, you don't really understand. No, I know. It just it gets very complex. So typically, intra-abdominal fat, visceral fat, very bad for you. We have very small amounts of brown fat in the human body.